Dear participants, I'm Fatemeh Khademolkhamseh, Master of Midwifery, Mashhad University of Medical Sciences, Iran. First of all, I would like to express my gratitude to the respected members of the webinar team that provided this valuable opportunity for us to share our knowledge. I want to talk about my article, which is part of my master's thesis. Its title is The Impact of Equisadom Arvens Vaginal Cream on Premature Rupture of Membranes in Primiparous Women with Hysteria Gravidarum, a triple-blind randomized controlled trial. Okay, this is the authors of my co-authors of our article. That is Samira Ibrahimzadeh. She is the supervisor of our thesis. Dr. Rakhshande, who is the pharmacist advisor, Dr. Mazloum, who is the statistics advisor, and Dr. Ayati and Dr. Akhlaqi, who are the gynecologists of our research team. This is the outline of my presentation. As you know, PROM is the rupture of membranes before the onset of regular and spontaneous uterine contractions. It can occur at any gestational age. It's divided into preterm and term, which can occur before and after 37 weeks of gestation. Its prevalence is completely different in different parts of the world, but its overall rate is 8%. It is associated with maternal, neonatal, and prenatal morbidity and mortality, such as increasing in the rate of hospitalization of neonatal in an ICU, and some maternal morbidities such as chorioamnionitis and also maternal sepsis, and increasing the rate of emergency cesarean section, which can occur because of the labor induction. There are some predisposing factors of the PROM, which are primiparity, history of PROM in previous pregnancies, and UTI and vaginal infection. And the other risk factors that is really important is Hysteria gravidarum. As you know, Hysteria gravidarum is a sign some colored reddish colored lines that can appear in the skin of some sites such as abdomen or breasts or sometimes on the thighs. It is a sign of poor skin elasticity, and the reduction of collagen synthesis plays an essential role in the development of it. In some studies said that the amount of collagen in the ruptured membranes was lower in intact membranes in the case of PROM. So, connective tissue defects and decreased collagen synthesis seem to be a common mechanism in the development of hysteria and PROM. And in some studies, reported that the severity of Hysteria gravidarum is associated with PROM, and the rate of it is higher in women with severe hysteria. Nowadays, the tendency of people, especially pregnant women, to use medicinal plants, that is a branch of complementary medicine, for the prevention and of disease has increased. Equisadom arvens is one of the oldest medicinal plants which can see a self-growth in Iran, and it also can grow in parts of the Europe and in Canada, and also in some parts of Asia, such as northern parts of China and in Turkey. The most important compounds of it is silicic acid, which is this plant is the richest source, and it can increase tissue elasticity, strength, and resistance by stimulating collagen synthesis, strengthening collagen fibers, and also connective tissue. This plant is also used as an anti-inflammatory, antimicrobial, and antifungal, and also for wound healing. And the extract of this plant has an inhibitory effect on a wide range of gram-positive and gram-negative bacteria. There are some studies, such as consumption of vitamin C supplementation, or using clindamycin vaginal cream, that they conducted in the field of PROM, but they have contradictory results. And also there isn't any study that is conducted in the field of PROM in the population of women with hysteria gravidarum. So the present study was performed to examine the effects of Aquisodum arvens vaginal cream on the rate of PROM in primiparous women with hysteria gravidarum. This study is a two-group triple-blind randomized controlled trial which conducted on 103 nulliparous women who met the inclusion criteria and referring to the prenatal clinic of Al-Banin Hospital and private clinics in Mashhad, Iran during 2020 to 2021, and using convenient sampling method. The individuals using 3% Aquisodum arvens vaginal cream or placebo from 37 to 38 weeks of gestation until delivery. They use this cream at least 2 weeks, and also they use a knuckle of it into the beginning of the vagina until 3-4 centimeters of the beginning of the vagina completely soaked in this cream. And in the case of rupture of membranes occur 2 hours before the onset of regular and spontaneous contractions, which can confirmed with 2-finger examination or touche vaginal, or using sterile speculum and nitrogen test. The PROM occur. These are the tools that we use in this study, and data analysis was conducted with SPSS version 25. They are the inclusion and exclusion criteria in our study. The pregnant women with the total hysteria score about a 9, which have moderate and severe hysteria, were included in this study. How calculate the hysteria score? Total hysteria score was calculated using a 12 scoring system in this study. Based on this tool, the skin of 4 areas of the body, abdomen, thighs, breasts, and buttocks, is evaluated in terms of color and number of hysteria. As you see in these 2 tables, 6 points are assigned to each area, and the sum of obtained score is interpreted as 0 to 3 without hysteria, 4 to 9 mild hysteria, 10 to 15 moderate hysteria, and 16 to 24 severe hysteria. That in our study, the people with pregnant women with the score of more than 9 in a category of moderate to severe were conducted and include. This is the flow chart of the selection of the research units and how they are randomly allocated and follow-ups and the final analysis. The results of our studies showed that 2 groups, intervention and placebo groups, are homogeneous in terms of basic characteristics such as age, BMI, total hysteria score, and educational level. About the our main variable, that is PROM, we can say that it is significantly lower in the intervention group than in the placebo group, as you see. And about the cause of hospitalization in maternity ward, the pregnant women with the complaint of onset of labor contractions was more in intervention group than placebo groups. And also, this difference were statistically significant. And also about the cervical dilation at the admission, which is also more in intervention group than the placebo group. So the cases of vaginal delivery is more in equisetum orvans group than the placebo group, and the case of cesarean section, as you see, was more in placebo group than the intervention group. This is the subgroup analysis of PROM in 2 categories of moderate and severe hysteria. As you know, the overall rates of PROM were lower in intervention group than placebo group, and this difference is, as you see, is statistically significant in moderate in the group of moderate hysteria gravidarum, but as you see in the slide, as you see, the cases of severe hysteria gravidarum, which in them occur the PROM is 0, and this is really interesting. But this difference is not statistically significant because the small number of people in this category. Using 3% equisetum orvans vaginal cream for at least 2 weeks significantly reduced the incidence of PROM at term pregnancies. It can be due to antibacterial, antifungal, and anti-inflammatory properties of equisetum orvans. It can be effective in reducing the rate of infection and inflammation, which is the most important and common cause of rupture of membranes. As you know, bacteria reduce the strength of membranes and their elasticity by activating inflammatory mechanisms. In one study, which examines cervical bacterial colonization in women with PPROM, preterm premature rupture of membranes. The most common isolated microorganism was Escherichia coli, and other microorganisms were Staphylococcus epidermis, Staphylococcus saprophyticus, Candida, and the other microorganisms that you see. It is really interesting that in another study reported the Equisetum arvens has antimicrobial activity against a wide range of strains, and its antimicrobial activity has been confirmed against the above-mentioned microorganisms. In another study, which investigated the effects of 2% clindamycin vaginal cream in women with bacterial vaginosis and the rate of preterm deliveries and PROM, it was reported that the rate of PROM it can reduce the rate of PROM. The result of our study is consistent with this study by the difference that in this study, the population of the study is women with bacterial vaginosis, but in our study, we use this cream in people, pregnant women without any UTI or vaginal infection. And also the other difference of this study with our study is that the aim of this study was that reduces the preterm premature rupture of membranes and preterm deliveries, but in our study we use this cream to reduce the PROM at term pregnancies. The other cause or probable cause for this reducing in PROM in our study is that due to the presence of silicic acid in Equisetum arvens. Equisetum arvens, as you know, is the richest source of silicic acid. It can stimulate collagen synthesis, strengthens the collagen fibers, and due to its binding to protein molecules, it can increase the strength and resistance of connective tissue. And also, Equisetum arvens is the source of vitamin C. Vitamin C plays an important role in collagen production and secretion, and serum depletion of vitamin C levels has been associated with PROM. As a conclusion, we can say Equisetum arvens vaginal cream is effective in preventing PROM in primiparous women with Listeria gravidarum. Therefore, its use is recommended as the herbal approach to prevent PROM in women with Listeria gravidarum who are at greater risk for it. Many thanks for your attention. This is my email address, and if you have any question, I would be happy to ask you. Thank you. Thank you so much for your attention, and also I really I would like to express my gratitude to the respected members of the webinar team to giving us a chance of sharing our knowledge to each other. Thank you.